All right. Good morning, everyone. Thank you for joining us today. We're going to be hosting a little bit different of a media briefing today. We're fortunate to have three strong local healthcare systems in our area joining us. We have Advocate Aurora Health and Aurora Bay Medical Center, Bellin Health Systems, and Prevea Health, HSHS St. Vincent, and St. Mary's Hospital with us. Our local healthcare systems, in collaboration with Brown County Public Health, will be offering a series of local media briefings over the next few weeks. We're calling the series Faces of COVID. The purpose behind these briefings is to put a face to what's happening in our communities in Northeast Wisconsin. Over the course of the next few weeks, you'll hear from those working on the front lines, you'll hear from patients and families, from behavioral and mental health providers, and you'll also hear from local businesses. These are not statistic-driven speakers. These are real people who have important stories and insights to share with all of us. They're the ones that are directly impacted by what's going on. Today, we're starting with faces from the front lines, physicians and nurses. They have personal and real experiences in dealing with COVID-19 on a daily basis and can offer perspectives that aren't often shared. Before we go to our first speaker, I will provide you with a brief overview of the current status of COVID-19 in Brown County. Today, Brown County is reporting a total of 11,765 positive cases. That's an increase from yesterday of 161. Out of isolation, we have 7,890 individuals who are out of isolation. That's an increase of 100 from yesterday. And we are currently reporting 76 deaths. As always, you can find an updated dashboard on www.stayhealthybc.com. You can also check out the Wisconsin Department of Health Services website for current information. As you've seen over the course of 2020, there has been an ebb and flow to this pandemic. Some might even say it's comparable to a roller coaster. When it comes to the current perspective on how we're dealing with COVID, it's the frontline workers who are experiencing the roller coaster on a day-to-day basis. Our first guest today is Dr. Munar Al-Shahuri. He's a Prevea Health critical care physician at HSHS St. Vincent Hospital and HSHS St. Mary's Hospital Medical Center here in Green Bay. Dr. Al-Shahuri cares for some of the sickest patients hospitalized with COVID-19 at both hospitals. Thank you, Dr. Al-Shahuri, for joining us today.
Good morning. Thank you. Thank you for having me. I appreciate that. So I don't want to talk necessarily about numbers and statistics and such. I think there are other more accurate and more important sources for that than myself. I just want to talk about the people involved in all of this on all sides, be it the patients, of course, who are the center of all of this, their families, who are also victims of this, frankly, that I don't think that are receiving the sort of care and support that they otherwise would and should get. And of course, there are healthcare providers, be it physicians, but just as importantly, if not more so, the nursing and the respiratory therapists and the housekeepers and everybody else is involved, because all those folks are risking their own lives, their family's safety when they do their job. Pandemics are very unique in the sense that they affect a community and the world in a way that it almost reshuffles and rearranges the social structure. And I think this is why it becomes a very political issue, a very social. A lot of people have very strong opinions because it has that power to reshuffle, as any major disaster does, the social order. So I would like to talk, and hopefully others, I understand there are nurses, I'll let the nurses speak for themselves and others, but I'll talk about the patients if I may, the patients and what happens to them. I often hear and I read on social media, I'm not a big social media person, but a lot of stuff gets quoted to me as, well, the mortality is, less than 1%. It's this, it's like the flu, et cetera, et cetera. And I keep thinking, these numbers, are real people. You've just put up mortality, was it 74 deaths in Brown County? There's 74 people who will never go home again. These are 74 people who were brought into the hospital either by family members or by EMS services, etc., who put on their clothes that day for the last time, who put on their shoes and socks that day for the last time, and this will never happen again. These are people whose families are going to go home and they're going to see their things laying around and they will never use them again. This is a very human issue. And I need us to focus on this, not on this very absolute number of, a mortality, etc., or mortality per capita. This is our community. This is who we are. I also hear a lot of talk about, do you guys have enough beds? Is there enough staff? Is there enough this? Is there enough that? And I keep saying, we're not going to win this by more ICU beds. We're not going to win this by more hospital beds. We're not going to win this by more staff. We win this by coming together, by all of us doing what's right and what is correct. Unfortunately, a lot of the appropriate smart things to do are become so politicized to the point that wearing a mask becomes a political statement. It is not. If you think about this, any one of you, people listening, when at your home,
Doctor, if I may interrupt you for just a moment, we're having some problems hearing your audio. So we will have Nathaniel check on that for you.
You can go ahead and try again, Doctor.
What I would suggest, if we can't hear the doctor, maybe someone on his end can double check his settings. And Claire, if we want to go to the next speaker and then try to return to the doctor.
Dr. Al-Shahari, if you can hear me, can you log out and then log back in? And then we'll come back to you after we hear from some of our other guest speakers today. So next up, we have several nurses who are joining us and will speak about their experiences. Andrea Chernesky is a cardiac services coordinator and a critical care nurse at Aurora Baycare Medical Center. Andrea is a single mom who has recently been assigned to serve as a critical care nurse in ICU bedside care. Before becoming a cardiac services coordinator, she worked as a bedside ICU nurse for 10 years, including during the H1N1 flu outbreak. She will share her story from the front lines. Andrea?
Hi, Claire. Good morning. Thank you for having me. I think that the discussions that we're having today are extremely important, and I think that putting a face to this, to the COVID crisis, is something that's really important for our community. Dr. Al-Shahari made some very good points and a lot of things that I think the majority of us who work within healthcare, can agree with. And that's really getting away from those statistics and really starting to see the impact that COVID has on our community, not only on our community, but on individuals and families. Together as a community, we are not only healthcare providers, but the people that we treat, especially being in a small town, our neighbors, our friends. A lot of times there's a lot of other connections there. I do have to say, the experiences that I've had in ICU, my work-life balance has changed completely. I was in a role where I was doing a lot more patient education and coordination of care, but when COVID-19 hit, I really had to put my ICU skills back to work to be able to help everybody out. They've been well practiced. When I was in ICU as a bedside nurse for H1N1, you hear a lot of comparisons between COVID-19, the flu, H1N1. Our patients during H1N1 were ill, but they were not as critically ill as the patients that we're seeing right now. They didn't spend the amount of time in ICU that our patients who have COVID are spending in ICU, and or the time in the hospital that our patients that we're seeing. This takes a huge toll on our communities, our loved ones. The isolation that these patients have to face while they're in the hospital is just heartbreaking to me. I'm a person who really tries to look at the positive so I don't get weighed down by the negative. And the things that I've seen at the bedside for the care for these patients has just astounded me. Nurses really reaching out and helping families to make those connections to their loved ones, making sure that they are doing everything that they can to incorporate the holistic care of that patient, incorporating spiritual things. We had a patient who was about ready to pass, and his family couldn't be with him. They were quarantined because of COVID, and he's a Catholic and very strong Catholic. And at the time, we couldn't even allow him to be anointed because anointing is a sacrament that has to be provided in person. And I saw the nurses really go above and beyond to make sure that his faith beliefs were adhered for. They were praying the rosary with him as he passed, and playing the rosary on YouTube because the nurse didn't know how to pray the rosary, because she herself is not Catholic and doesn't share those beliefs. So we're seeing things like that throughout our whole teams. We've had a lot of people coming in to help us. It's been absolutely incredible, the outpouring that we've received in accolades from community service, but we really, really need the community to put that in action. To say thank you to the nurses and doctors is wonderful, and we appreciate it, but it's more important, and it's a better gesture to wear your mask, socially distance, wash your hands and wash them often. When I sent my son to school this year, my message is for him. He got to do in-person school. One of the challenges that I face is, like all of us, figuring out the whole school situation. But when he got to go back to in-person school for a little while, they're now off that, they're on virtual learning. But my advice to him was, wear your mask, wash your hands. When you think you've washed them enough, wash them again. Keep a distance from people and be kind. We understand everyone is going through a lot of challenges at this time, and those challenges are unique. It seems kind of cliche because we see these quotes and all of these beautiful calligraphies about you don't know what burden another person's carrying. But right now, I think it's really important for all of us to remember we don't know the burden that another person is carrying. And protecting each other as a community is the only way that we're going to get through this. From top to bottom, we need community involvement. We're here to take care of you when you're ill, but we'd rather see everyone taking care of themselves so that you don't have to get to the point where you need to depend on us. Masking is the way to do that, washing your hands, maintaining distance. One of my sayings is, when we all give, we all gain. And that's, I think, really where we're at as a community right now.
Thank you so much for sharing. Looks like we have Hurry back. Doctor, can you hear me?
Yeah, I can hear. Can you hear me? Okay, perfect. I'm sorry. So I'm not sure where I went on, so I wasn't sure where I left off and where you last heard. But what I was saying earlier, I think, was the fact that I was making a comparison between the different workplaces and the requirements by OSHA and others to maintain somebody's safety at their place of work, their own homes, the way they're built, they're built up to code to ensure safety, etc. And this pandemic should be no different in our thought process in as far as what do we have to do to ensure that we protect ourselves, we protect our families. And I'm sure this has been the experience of others, where we're admitting families, essentially multiple family members from the same household that are coming in together who are sick in a hospital. This is our community, these are our people. And I want people to move away from this idea of wearing a mask or social distancing, etc. And this becoming a political issue. It is not. It's a safety issue. It is no different from the measures you have to take when you are at work to protect yourself, protect your colleagues at work, etc. This is the same idea. The American people have always been problem solvers. This has always been our strength. We figured out how to get to the moon, land a person there. We have done all of these things. We lead the world in medical innovations. This is not beyond our grasp, and we just have to hark back to these skills that we have. And remember, at the end of the day, forget the numbers. We do this together. We as one community do this together, and it starts literally one person. One person, a pandemic literally makes the difference. And what I mean by that, all these super spreader events, one person. Think about that. Let that sink in. Thank you.
Thank you so much for sharing, Doctor. Next, our next guest speaker is Jessie Schomberg. She's a clinical nurse specialist who is an integral part of the COVID-19 team at Bellin Hospital. Jessie's been an RN for 17 years with bedside intensive care unit experience. In the past 2.5 years of her career have been spent in a leadership role working directly with care teams. She has played a key role in Bellin's COVID-19 preparedness and response and offers a unique perspective on the day-to-day realities of the frontline healthcare worker experience. Jessie?
Hi, Claire. Hi, everyone. Thank you for letting me participate in this. I just first want to say, Dr. Al-Sahari and Andrea, everything you've said is spot on, and it's just spot on. I couldn't agree with you more. From things that I've experienced and staff here has experienced, I see this constant everyday reassessment of what the situation is, where are we at? And yes, you speak of the numbers, but these are people. But the constant reevaluation and planning that we're doing on a daily basis. Something that has been brought up numerous times is that you don't just get admitted with COVID-19 and lay in a bed and just get medications and get oxygen and you will get better. It is a fight. It is a struggle, and it takes a lot of energy. One of the quotes that our respiratory therapist had made was, I've seen more 60-year-old men cry in the last 7 months that I've seen probably ever in the history of in my career. The isolation, depression, anxiety, and fatigue take a hold of these patients and makes this battle so challenging. And again, as mentioned, the isolation from families goes against everything we believe in the healing process. So that's a challenge. I've seen amazing things, just like Andrea mentioned, from coworkers, the creative things they've come up with to help battle this has been really incredible. Just incredible. The proning of patients, they look like a synchronized swim team. It's just, they've come together and worked so hard to make this all happen. I've seen absolute, true leadership qualities come from staff that maybe you wouldn't have seen otherwise, but it's mentally exhausting for them, without a doubt. Wearing a PAPR all day or whatever PPE that you're wearing is challenging, and it's an experience you can't necessarily describe unless you do it yourself. It's I think of the PAPR and the wind blowing like a breeze, but it's not a tropical breeze. it's taxing. You're thirsty, your mouth is dry, you're in there for 12 to 13 hours. You can't just go sneak a drink of water. There's so many things that you're limited on. You can't run to the bathroom. But again, we're going to do those things because we're taking care of people, not numbers, but people. And I think I can speak for every nurse when I say we and physicians, all staff, we pride ourselves on providing quality care. We thrive on that. And being inundated with critically ill COVID-19 patients threatens this for us, and we are challenged with providing that care. But something that I've noticed from the beginning from staff is that they all say they were not prepared for the attachment that they have had with many of these patients. Yet there's, like you mentioned, doctor, there's families admitted. They can all tell you 1, 2, or 3 patients that they will never forget. They can tell you about them. They can tell you that it was, someone's birthday and she turned 80 that day, and she went to the window to wave to her family out the window and died the next day. And they can tell you her favorite thing in the world was chocolate. The connection. You didn't have to be here, and you didn't have to be here. And nobody needed this. This shouldn't have happened, which is the point I think that we all have, that this didn't have to happen. And it is truly, our responsibility. And like you mentioned too, Andrea, sending your child to school, same thing. Wash your hands, wear your mask, and wash your hands again, and be kind. So that's what I have.
Thank you so much for sharing, Jessie. So thank you again to all of our guests today for agreeing to be here with us and sharing their stories. Brown County Public Health would like to reiterate everything that everyone has shared. Please continue to wear a mask or cloth face covering when you're out in public. This includes indoor and outdoor spaces. Wash your hands, physically distance from individuals as best as possible, 6 feet or more. And remember that your individual actions affect the community as a whole. So what you do today will impact what happens tomorrow and in the future. Before we go to question and answers, I'll share with you that our next media briefing will be on Wednesday, October 21st at 11 a.m. Joining us will be some COVID patients and family members talking about their personal experiences. And with that, we will take your questions. If you could please state your name and the media outlet you are reporting from and who the question is directed towards.
Rob Sussman, WTAQ. This question is for you, Claire. I know that the Tavern League Wisconsin has filed suit regarding the governor's capacity order, and their temporary injunction has been put in place in regards to that capacity order. I was wondering what the official position of the Brown County Department of Public Health is on that one.
Hi, Rob. Our corporation counsel, our team of lawyers is currently reviewing the judge's order and what that means. And once we have definitive answers about what to do with next steps, we will share.
Thank you.
This is Kia with Channel 11. This question is really for any of the healthcare professionals. We've been hearing from our viewers that some are concerned with the accuracy of concerns when it comes to capacity. A lot of folks are thinking that capacity concerns have a lot to do with elective surgeries rather than just necessarily coronavirus or COVID patients. Could any of you guys speak to that? What would you say to the viewers that are saying, these capacity concerns are having a lot to do with people getting elective surgeries?
This is Dr. Al-Shahari. Can I just tackle this? Maybe others can chime in. Simply untrue. It's just simply untrue. we are at near capacity with ICU care and other floors. There's a number of elective cases, etc., that have been rescheduled and canceled. So wherever that's coming from, it is completely inaccurate.
I'm going to
Thank you,
agree
Dr.
with.
for making that clarification.
I'm going to agree with Dr. Al-Shahari on that one as well. You know, our capacities at our hospitals are built to flux, and they're built to have these elective surgeries into them, along with community-based illnesses like our regular influenza and that kind of thing. So on a normal year, this is a very busy time of the year for us. We're gearing up to the end of the year. We've got a lot of elective surgicals coming in because people want to get their deductible, or like where their deductibles are met. We're used to a large influx of patients at this time due to community illness and due to elective surgeries. This is above and beyond that by far. Elective procedures are important. Preventative procedures are important. Because COVID's there, it doesn't stop what's going to be coming in the next few months. My background is cardiac services coordinator. Typically in hunting season, we start to see people come in with MIs, and that first snowfall of the year, those two big things in this area due to our weather and the activity level of people who may or may not have been otherwise active, I call those our own self-stress tests. So those are influxes that we're very used to seeing. There's usually, we can predict a pattern of what's happening, but this has just blown that out of the water. Shutting down elective procedures is definitely not the way to help things along. We do have a stage-wise approach, I know, based at our hospital, based off of where our COVID numbers are at, where our hospital numbers are at, and when our surge plans do include limiting those things when we get to that point. But elective procedures are not why our hospitals are full right now.
Can I just say one more thing? I don't know if you can hear me, but this whole thing about us continuing to debunk these ideas, it's almost like whack-a-mole. To me, the bigger picture here is that there is a lack of trust, or at least some mistrust here, from the information coming in, because we can continue to talk about this. Well, there's you guys are doing this, all physicians or nurses, because that's how they make their money, or is it because they're, what was the expression when used, the Chicken Little prognosticators, etc., etc. Look around you. You as an individual in your community. We are one of the hotspots in this country. Look around you. Look, how many of your listeners or your audience does not know a single person who has been affected by this? I would like to know that. Have them just stop and think about that. We have I think a 22% positivity rate in the community. Chances are most of us know somebody who has been affected by this. 74 deaths in Brown County. So for somebody to sit there and to say that, I mean, come on, let's just look at your community. Enough with the social media quackery. I'm sorry, I'm just kind of tired of this. Just look around you. Just use your senses and look around and ask around. That's all I got to say.
Well, thank you. I know these questions are tough, so I really do appreciate you guys taking the time to answer them in the first place. So thank you. If I could, I just got one more for you, Claire. And this has to do with that alternate facility. It seems like they're wrapping up the preps on getting that ready. Would you have any numbers as to how many patients specifically from our area, Brown County, and even surrounding counties, Outagamie, Winnebago, if you're in touch with those folks, will be sent to that alternate care facility, or are you guys not there yet?
So the decision to send somebody to that alternate care facility would be between the healthcare system and that alternate care facility. So I would just say, reaching out to Prevea, HSHS, or Aurora, or Bellin, or anyone. That's not a decision we would make. Mm-hmm. So it would be between the healthcare provider who is treating the COVID-19 patient in Brown County and that alternate care facility.
All righty, thank you for that clarification.
Hi, my name is Benita from the Green Bay Press Gazette. And this is a question for any of the healthcare professionals here. So the West Superior School District just announced that they're going back to in-person classes, and they say that that schools reopening are not significant contributors to the community spread. So just wondering if you could react to that, if that's true or not.
Okay, I'll just say something about that. I think this is clearly a very a complicated issue, and unfortunately, it's one of those subjects that have been contaminated by politics, et cetera, et cetera. So I can tell you this, and I'm just going to give you some examples of what happened in other parts of the world when they opened up schools. So, for instance, I often hear this cited. In Spain, they did that, and there are a bunch of other European countries. The positivity rate in the community for them to be able to do that and do that safely was less than 2%. We are at 22%. So just keep that in perspective. And I can also tell you that although this is always an issue of flux and changes with time, that what drove, although this is not necessarily, we're not necessarily blaming anybody or pointing fingers, but you have to understand that this one of those more recent, what drove the most recent surge, if you will, was by folks in the 18 to 20 some, so the college kids and the high schoolers, et cetera, that drove this. I am fully aware. I have children. I understand the impact this had on them, on the teachers. The teachers are heroes. They're also risking their lives, frankly. It's a complicated issue. But to me, honestly, look, this has to go back to we all have to do this together, all of us. You know, so if I say, well, open up the schools because, you know, the children, this affect them, I get it. That's a very valid argument. Open the schools because the parents have to go to work. If they don't do that, they can't go to work. It's also a valid argument. Ultimately, what is the logical conclusion to all of this? The logical conclusion is we as a society have to, as a community, have to come together. And that includes social distancing, that includes, frankly, you know, these weddings and the funerals and the get-togethers and the barbecues and the no masking. I mean, you can't have it both ways. You know, we have to make that decision. So yes, we can argue back and forth about the wisdom of opening up schools. Yes, we can have it, you know, well, you know, I need to open my business. We want that. We want that flexibility. But for you to have that, for you to feel safe at home, you need to have a smoke detector. To know to go to sleep. You have to have that. You have to have maybe a security system. You know, at work, you need to know that there are certain measures in that keeps you safe. And why is this any different? It's not. So, you know, yes, we can talk about these issues, but we have, as a community, have to come together. Maybe at this community right now, as an example, the De Pere area, it may be safe. I don't know. But you know what? This may not apply, you know, somewhere like in Appleton or somewhere in Milwaukee or in Boston, because the situation there is different. What the community there decided to do worked better. So there is no one answer, blanket answer. It all depends on what is being done locally. What are you doing as a community to address this issue?
Okay, thank you so much. So I just have one more question for Claire, if that's okay. I was just wondering, so with people who might be complaining about masks or sending in complaints about that, are you guys kind of responding to those or like issuing any citations for that?
Hi, Benita. Yes, we respond to all comments, concerns, messages, calls. We document each one that comes in and we respond. And right now, just as the governor has stated earlier this month, our main goal is education and support. So it's not to immediately administer a fine or send people out there to do disciplinary actions. Education and support. What can we do to help you and your facility, you know, remain open and follow the guidelines that have been set forth for the state? So education and guidance. And then if we continue to see you know, blatant disregard of the mandates and the guidance that's been set out, then we would, you know, visit with them again and continue to monitor their activities. and their actions, and then it would come to a fine. So we haven't gotten to that point yet. We appreciate everyone who's calling and sending us messages and showing us their observations in the community. But again, our main goal as public health is always education first, education and guidance first, and then monitoring and assessing the situation going forward and taking action as necessary.
Okay, thank you. And thank you guys for having this today. And I really appreciate everything that you guys are doing.
Do we have any other questions today for any of our guests or myself?
Yeah, one more, if you don't mind. Rob Sussman from WTAQ. Andrea had mentioned something very interesting about how they kind of look forward and anticipate certain surges as they're seeing right now in even things that aren't COVID. My question for the healthcare providers then is, do you see this getting worse before it gets better?
This is Andrea. That is a difficult question to answer. You know, we know statistically, based off the number of people that are being diagnosed in the area, about what kind of numbers we're going to see in the hospital. But without community control, those numbers are going to continue to be admitted to the hospitals, and the length of stay for these patients is so much longer than for a lot of other illnesses. So we know that our capacity is going to be stretched, and it's going to continue to stretch until that community spread can be decreased.
I totally agree, and I will add to that. It's honestly a big part of this is up to us, is how we behave and how we conduct ourselves, and how, if we remain and stay logical, that is going to be up to us. You know, and we need to understand something, that there's a lot of optimism about a vaccine versus, I don't know if we'll have a vaccine in a few months, by the end of the year, we don't know. We don't know. So we have to plan accordingly. We have to plan. We have to learn how to live with this thing and function with this thing. And I agree, shutting things down is not a smart thing to do. It's not an option. Was never the intent. All of these were attempts to a pause and if you will, a restart, or whatever you want to call it, to give you a chance to regroup there and have an attack plan against this thing. But ultimately, is as how we behave is what determines this. So yes, are they going to get worse and they get better? But the thing about it, we keep behaving this way, it's going to get worse again and better again, and back and forth and back and forth. We need a strategy.
Hi, this is John from MEC 26. Kind of jumping off an earlier question, is the governor's order to limit bar and restaurant capacity to 25% an important tool for this area in particular right now, or do you see that not really having an effect?
Doctor, I can take that one if you want to jump in. I think the order is to help remind people how their individual actions affect the community as a whole. So like Dr. Al-Shahari was saying earlier, weddings, funerals, barbecues, gatherings, just because you have a wedding and all of Brown County is not invited doesn't mean that your wedding is going to affect the whole community. So I think the mandate, the masking mandate and the 25% capacity order are tools. Like Dr. Al-Shahari said, we don't know if we're going to have a vaccine. We don't know when that's going to happen or how that's going to happen or where. So the order is a tool to help us slow the spread in our community, and to try to help individuals and businesses still stay open and operate safely and healthily, but also to slow the spread of COVID.
Thank you, Claire. A quick unrelated question for you. We've heard about these rapid tests being deployed to communities that are kind of hot spots. Are you aware, is Brown County going to get some of these soon? Are these going to be deployed to nursing homes or other entities that it would make sense to have access to rapid testing?
I would direct that question to Wisconsin Department of Health Services. If we do get those tests administered to us, it would come from DHS. So I'm not sure at this point if that's something that they're considering giving out to the counties. So I would direct that question to them.
Thank you very much, and thanks for hosting this.
Any other questions? Oh,
yeah.
Go ahead.
Sorry, George Ortiz with Spectrum News here. This question's for you, Doctor. First off, your passion and your frustration with what's been going on is palpable, and there are a lot of people who share that. I'm curious, in your entire career, have you ever experienced a time where trust has been such an issue for so many people, and how do we overcome this given what we're facing right now?
I'm sorry, I assume this is directed to me. Is that correct? Okay, thank you. So by and large, if you actually look at a pandemic and pandemic history, and this is, again, this is the power of a pandemic, power of any sort of natural disaster. One of the first casualties of that is the truth. One of the first casualties there is information. And this is why transparency and availability of very truthful, verifiable information is super, super important. And part of the reason I agreed to do these, and I'm super busy. I know you've noticed I've been answering my texts and stuff while we're doing this, because this is super important, because you guys hopefully are going to be a conduit to a lot of truths out there, a lot of realities that we all have to share. The problem with pandemics and natural disasters, when you start have these alternative explanations for things, this tears at the fabric of our common reality, and when that happens, then bad decisions ensue. So when you question a lot of facts and a lot of truths, if you will, and people start going elsewhere. And elsewhere is somebody's either ignorant or has a more malicious intent. And so when we start questioning some basic things, such as masks, and we're going to argue about show me data that masking makes a difference. There is data, actually, and there is some good data. If you're a scientist, you can read through it and you can analyze these papers. And I'm sorry, I'm not a statistician. I can probably not critique it as well as somebody else, but I can read a conclusion and understand that there is such data that makes sense. The problem is these sort of truths, these sort of very effective measures are being questioned. And this is where it's very important for community leaders, be it a politician, be it your pastor, be it your priest, be it your mayor, etc. Those people have to be up in front about this, because they got to that position out of trust. When we elect people or they assume leadership roles in a community, they assume it not because they're good looking or have fantastic.
I think we lost your audio again, sir.
Doctor, can you hear us? We lost your audio again.
Right when it was getting good. He had that twinkle in his eye, and then
we'll give him a chance to log off and log back on. Any other questions while we wait for him?
Well, real quick, if I can, just thank everybody for sharing time, because as the doctor said, you guys are very busy. We all know that, and we appreciate you speaking up about some things and some difficult topics here. So I appreciate that.
I apologize. Can you hear me now?
Yes.
Yeah, I don't know why this keeps disconnecting. I don't know. I think it's the North Koreans, but I could be wrong. So, what I was saying earlier, and I don't know where I was cut off there, was, to answer your question as far as the loss of that, the reason, the part of the issue is, as in any natural disaster and pandemics, is truth is the first casualty of all of this. And it's, again, very, very, very important that the truth by such forums be put out there, very transparent, to kind of take on even the most absurd questions. It's important that you do that, because in a pandemic, one person makes a difference. If I convinced everybody in a room and one person is unconvinced and that person happens to be a super spreader, then the whole message is lost. So, again, reiterate the fact that I would like to see our elected officials, our community leaders, be at the forefront of addressing these issues, because those folks came to their position out of trust. We elected them. They rose in the ranks of their individual institutions and such out of trust being put in them, and so that's important. So there's nothing unique necessarily about COVID-19 that it's all of a sudden caused a loss in trust. In any society, there's always this issue. There's always this, but unfortunately, in a situation such as this, there's an uptick in these conspiracy theories, or somewhat something that would seem unremarkable. There is always this flat earthers out there. There's always this people who never landed on the moon's conspiracy theorists, and they have these elaborate, very smart, interesting discussions. But at the end of the day, they're not consequential except in a situation such as this. I don't know if that answers your question. I'm not being too philosophical about it.
Well, it does. I think you speak to several points, and you've answered it very well. Thank you.
Thank you.
And thank you for continuing to work through some of the technical difficulties. We appreciate that.
Thank you.
Any other questions for us today? All right, Nathaniel will send out a recording of the WebEx for you guys after we're done here, and we will see you next week. Thank you.
Can I say one last thing, please? Do you have a second? I just want to hammer this home. We can only do this together, all of us. We are all in the same boat. For you to say that my side of the boat doesn't have a hole in it, so I'm okay, but makes no sense. We all should do this together. We sink or swim together. Thank you for your time. I really appreciate all of you guys. Stay safe.
Thank you, Doctor.
Thank you.